I'm your host, Norman Weiniger. And as you know, we aim to bring you information in these podcasts that's accessible to everybody on ways that people can support and maintain their well being. And today, we're going to be discussing an issue that probably needs more discussion than it often gets in society, and that's the issue around mental health of new mothers during the postpartum period. We often think of the addition of a new baby into a family as uh, always being considered a big transition that comes with many physical and emotional challenges for the entire family. A lot of joy, but a lot of other emotions and challenges as well. So, in this podcast, we're going to discuss a few of the common mental health challenges that new mothers may experience postpartum, and especially how friends and family around them can be of support during this important stage of life. Now, today our guest is Yeji Lee, my colleague who is a social worker and a mental health professional. She's also a mother herself. She's familiar with the challenges that mothers face during pregnancy and postpartum. Welcome and thank you for being with us today, Yeji.
Thank you for having me, Norman. I'm excited to talk about this very important topic today.
Okay, great. Well, let's jump right in. Most people, Yeji, I think, are familiar with the 3 trimesters of pregnancy and the process of labor and delivery. But maybe can you talk about the duration of the postpartum period and maybe what are some misconceptions people have about this time?
Certainly, Norman. So according to the National Institute of Health, the postpartum period is divided into 3 phases. So the first period, we refer to it as the initial period, involves the first 6 to 12 hours postpartum. So the first 6 to 12 hours after you've had the baby. This is considered a time of rapid change with a lot of high risk for immediate medical crisis for some people, such as, postpartum hemorrhage or eclampsia, which is, high blood pressure and risk of seizures. Second phase is the subacute period, and this is the phase that lasts 2 to 6 weeks postpartum. And during this phase, the mother's body goes through a lot of recovery following delivery of the baby, and it's undergoing major changes to the body and to the mom's emotional status. The third and final stage is called the delayed postpartum period, which can last up to 6 months. And changes during this phase are gradual with low chances of immediate medical crisis. Although most people consider the postpartum period to be a very joyous time with the addition of a new baby to the family, as Norman mentioned, it can be a very challenging time for mothers and surrounding members of the family. Often, the postpartum period is nicknamed the 4th trimester. It's with the underlying message that the postpartum period can be just as difficult, if not more difficult, than the 3 trimesters of pregnancy. Now, there's a common misconception that a mother who does not seem to be thriving postpartum is not fit to be a good mother, which is far from the truth. It's important to remember that it can take 6 months post-delivery for a mother to be fully restored to their pre-pregnancy physiology and just self in general. On top of all of the physical changes within the postpartum period, there's a lot of mental changes that are happening as well. And this is just, it could be due to fluctuations in hormones and the drastic life adjustments that come after having a baby. Everybody experiences challenging life adjustments at some point in their lives, and having a baby is just another very, very big life transition, especially the case for first-time parents.
Can you talk about some of the common mental health challenges that new moms face?
Yes, so there's a few postpartum mental health, challenges that mothers may face. I'm going to talk about some of the more common ones. The first being postpartum blues, otherwise known as baby blues. I think a lot of people have heard about this, and it's just kind of a phase of emotional change after childbirth. Mothers may experience frequent crying episodes, higher irritability, confusion, and anxiety. However, all of these symptoms can still be mixed in with feelings of happiness. Mothers are still functional without a need for active intervention, except for, the social support that all moms need postpartum. This is very common, baby blues, very, very common and experienced by most women to some extent. In Western countries, it can be as high as 40 to 85%. And symptoms with baby blues arise within the first 10 days postpartum, and it may peak around 3 to 4 days postpartum. The second one is a little bit more, you may need a little bit more help with this one, but it's the postpartum depression. It's the most common mental health issue seen within the postpartum period. People who have postpartum depression, they may have negative thoughts related to the newborn baby, and it's seen in about 10 to 15% of postpartum women. So it's, it may be more common than people might suspect. It can also be associated with feelings of guilt or inadequacy about the mother's ability to care for the baby, as well as a preoccupation in the baby's well-being or safety. I want to note that postpartum depression is also associated with a very high incidence of anxiety symptoms as well. Now, those are kind of, baby blues, depression, those are kind of the more common types of mental health issues you see with women postpartum. Now I want to mention just a few of the not as common mental health problems that can happen. First one being postpartum psychosis. This is characterized by a sudden onset of symptoms that include mood changes, rambling speech, disorganized behavior, hallucinations, or delusions. Postpartum psychosis is considered a medical emergency, and it's observed in about 4 to 5% of women suffering from this. And if you are experiencing this, or you know someone, or your partner is, professional help should be sought immediately. Postpartum PTSD is another one. Incidence of this is about 5 to 6%. And the last one that I want to mention is an obsession of child harm. This is kind of characterized with women who may be experiencing postpartum depression. They may experience repetitive, intrusive thoughts of harm happening to the baby, leading to compulsively checking on the status of the baby.
Thank you. I understand those are significant, but fortunately much less common occurrences. When should people, Yeji, know to think about getting professional help with any of these matters?
Generally, if your symptoms of baby blues do not subside after 2 weeks, or you feel very intense symptoms of any of the mental health issues mentioned, it causes difficulty in your daily functioning, you should seek professional advice from your doctor, your nurse, your midwife, or a mental health professional. If you have thoughts about harming yourself or the baby, you should, immediately call your medical professional to seek help and treatment. If that's a difficult task for you, then you can always ask your partner or a loved one to help make that call for you, or to help you seek the help that you need. You will most likely be treated with, either therapy, education, and or medication if needed. Now, it's also important to note that symptoms of postpartum depression can happen right after delivery. It can happen within any time within the first year of having your baby.
Thank you. So it's really important to be aware of this in that whole first year, it sounds like. Now, Yeji, many of us are not new moms, but many of us are friends and family members of new mothers. So how can friends and family members support a new mom?
There are so many ways to support a new mother, whether you're a partner, your family member, or your friend. A few ways could just be, cooking a meal and dropping it off. You can also help out by helping out with their groceries, or giving them gift cards that they can use for takeout. Offering your time by helping out with things around the house, or maybe watching the baby for an hour or so the parents can take a rest or take a break, take a nap. Another big one, an important one, is checking in on the parents specifically. I think there's so many times where people are, so much more invested in the baby than that the mother's well-being might be overlooked sometimes. And that's understandable. There's babies new to the world, and, there's so much love and attention that goes to the baby. But, it's important that you be there for the mother by just paying attention to how they're feeling and asking how they're doing. Another way is to support their medical care. You can offer to drive them for postpartum checkups, or even just offering to help them find assistance with whatever it is they need, whether it's with breastfeeding, with their mental health care, or any other postpartum need. And the last tip I would have is to just continue to show up. Keep reminding the mother or the parents that you are available to assist them, or even if that's just being like a good listening ear. It can be difficult for new parents to even know that they are in need of help, and it can be hard for them to ask for help. So just continue to offer maybe like a specific day, a specific time or service to help remove some of the weight. Now, I have a little bit of tips on what not to do, because I think this is also important to kind of point out. One would be to don't badger the parents for any photos of the babies. If they want to send photos of the babies, that's great. If they don't, I would just say kind of wait until the parent is comfortable sending pictures. I think in today's age of technology and social media, that can be a touchy or a sensitive topic for new parents. Another one would be to just don't show up unannounced. If you are welcome for a visit, keep it short and practical, and be mindful of germs. Babies are very fragile and vulnerable, so always just, be cautious of that. And the last one would be to offer a safe space to share how parents are feeling. Just, simply listening to their struggles and offering your validation to their feelings can do wonders for a new parent struggling with a very big life transition.
Wow, thank you, Yeji. That is great information. I sure learned a lot. I hope that anyone in the audience who is a new mom, is going to be a new mom, uh, someone who has someone like that in their circle of friends and family, hope they got a lot out of this, and I'm sure they did, and it's great information on a complex issue that society sometimes doesn't talk a whole lot about. So, Yeji, thank you so much. Really appreciate it. And with that, that concludes our podcast today. And on behalf of everyone here at Aspire, thank you so much for listening.